live here.
We live here.
We live here.
We live here.
A project exploring
race,
Class.
Power.
Poverty.
Systems and the people they touch.
I'm Emmanuel Berry.
And I'm Tim Lloyd.
And from St. Louis Public Radio.
This is We Live Here. We're working our way through a series of shows on health, and you might think we're about to take you through an audio version of Grey's Anatomy or ER.
You know, but a little less drama, maybe. I don't know. But, you might be expecting things like a hospital sounds, like a classic, like a heart monitor or something. Boop, boop, boop. Oh, God, Tim. Don't quit your job and become a Foley artist.
I won't.
You don't have a career in that. Anyway, or you might be expecting, someone rushing through the door saying, I need something.
Stat.
Yeah, right now.
Stat. Yeah, and we might end up in those places. You never know. But Jason Purnell of Washington University says when you're talking about health, where you get treatment is really just one small part of the picture.
Health happens where we live, learn, work, and play. And it goes far beyond what happens in a hospital exam room or a doctor's office.
Purnell is the lead author on a study called For the Sake of All, which looks at the connection between health disparities, race, and class in the St. Louis region.
Yeah, really smart guy.
Yeah, smart dude. We're going to reference that report a lot. So we took his advice. We went away from the doctor's office, and we went to a place that just about everybody has spent a big chunk of time in their life, and that's school.
More specifically, Northside Community School, a charter school located in the Kings Highway East neighborhood in North St. Louis.
Quick disclaimer here, this school is sponsored by the University of Missouri-St. Louis. Our station is also licensed under UMSL, but that did not factor into why we visited this specific school.
So here's why we came to this pre-K through fifth grade school. Any student living inside the city limits of St. Louis can attend any charter school, but most students at Northside live in North St. Louis. The student body is almost entirely black, and it's set up to serve primarily low-income, at-risk students, and 100% of the students receive free and reduced price lunch.
There's another 100% you should know about. It's what the school received on its annual report card from the state for the past 2 years in a row. And one final number before we get underway, 4. That's how many parts there are to the show. And each time we move on to a new part, you'll hear this class bell.
So after this break, we go to school.
Good morning, London. How are you? Good morning, Mr. Nino. All right, you want breakfast? All right, get to it.
Okay, part 1, hunger and nutrition.
And what better place to start than in the cafeteria on the first day of the school's optional summer session?
It is important for them to be nourished as they are going to class. I mean, you can walk without fuel.
That would be Stella Arandu. She's the principal of the school.
She says a big part of that student success we told you about earlier starts with breakfast.
So we really term the breakfast as the fuel of the day, which everybody knows that breakfast is that important.
Yeah. Mm-hmm. It would be fair to say that there's a fair number of your students in here who maybe didn't eat dinner at home last night.
Oh, yeah. Yes.
Can you tell me about what, if you had to guess at the percentage?
Well, it's not scientific. We have not ever gone to them and said, did you eat dinner last night? We haven't done that. And I don't think we should. That I can comfortably say about 10-20%. The kids will talk to me. They'll tell me, you can ask the cooks. Some kids will say, I want second, I want third. And they do get them. We if they need it. And that's the sign to us that they didn't eat dinner at home. Some are too shy to say anything, and we go to them and ask them, did you eat dinner at home? Do you need more? Do you want seconds? And they will say yes, and they get it.
We're going to be hearing from Principal Arandu throughout the show about all the health issues she sees in the school.
And they don't just worry about feeding kids. They also worry about developing kids' appetite for food that's good for them.
Yeah, easier said than done.
No kidding. And Veronica LaCapra helped us out with this show and spent some time in Northside's kitchen with the school's food service manager, Mike Combs.
Mike is the guy when it comes to what the kids eat while they're at Northside. He plans breakfast and lunch menus, orders all the ingredients, cooks up all the meals, and serves them.
You too. Because Mike's on a mission to get the kids at Northside to eat healthy food, one of the first things he did when he started working in the school's kitchen was to get rid of the fryer. so everything he makes is either baked in the oven or cooked on the stove.
Today we're having baked chicken wings, macaroni and cheese, and spinach.
Mike says he's already gotten the kids really into some foods many of them had never tried before, like yogurt. But vegetables are a much tougher sell. Mike says sometimes he tries little tricks to disguise unpopular veggies, like putting a sweet glaze on carrots so they taste more like sweet potatoes.
I'm going to try a trick with that spinach. I'm going to season it just like they would get seasoned greens at home. I'm going to use garlic powder, onion powder, and I'm going to use a ham paste to give it the flavor of when they're at home eating mixed greens or collard greens or mustard greens. And hopefully, if they can get past the look of it, they'll go ahead and try it.
So, sorry to interrupt, especially so soon, and this may seem like a really obvious question, but why is there this big push to get kids to eat healthy food at school?
Well, on the most basic level, it's the law. There are federal nutrition requirements for school meals that got stricter a few years ago under the Obama administration. Among other things, the regulations require schools to increase the amount of fruits, vegetables, whole grains, and fat-free and low-fat milk they serve.
Yeah, and they're also supposed to reduce levels of sodium and saturated and trans fats, that kind of stuff.
Yep, that's right.
All right, well, just leaving the law aside for a minute, there are good reasons why we'd be worried about what kids are eating, right?
Absolutely.
Yeah.
One very real problem is that about a quarter of children and teenagers in Missouri are either overweight or obese. And nationwide, that number is closer to a third. Melody Goodman, she's a professor of public health at Washington University who studies racial and economic health disparities, says schools play an especially important role in helping low-income kids develop healthy eating habits.
Multiple ways. So for some youth, they're getting 2 of their 3 square meals at school, right? And so you want those to be healthy meals. When I was growing up in New York, French fries with ketchup was considered a vegetable, right? Because some smart person figured out how to make that math work, right? But it's not really a vegetable, and we shouldn't be doing that to our children, right? And so, if they're going to eat 2 of their 3 square meals at school, those meals need to be healthy. Making schools a place where, health is normal and the healthy choice is sort of the easy and sort of most available choice, I think helps kids develop healthy habits that extend into adulthood.
So what makes it so hard for kids to have or get a healthy diet?
There can be lots of factors. Fresh produce and meat are expensive. Parents who are working long hours or multiple jobs may not have time to cook. And many people live in neighborhoods that just don't have a grocery store or good public transportation to get to one. Those areas are often called food deserts.
I just want to point out really quick that Northside Community School is not in a food desert. There's a grocery store less than a mile away.
That's true. But like Melody Goodman said, since kids spend a lot of time at school, schools do have a big role to play in making sure they get enough exercise and healthy food.
Right. So let's get back to food manager Mike Combs at Northside.
Okay, and one thing I forgot to mention is that the day I visited the school was kind of a special one on the food side of things.
Oh, yeah?
It's what's known as a Tri-Day. Tri-Days are all about the kids trying a new food that Mike has never served before. To get them to do that, Mike says it helps to have an incentive.
Or we have stickers.
The stickers he's talking about, they're blue and round, with a picture of a frog drinking milk through a straw and holding a bright red tomato. Every kid gets one if they try the new food. It's always something healthy. Usually, it's a vegetable.
Everyone that tries the vegetables, they don't have to eat it all, but some of them, once they taste it, they'll let you know when they get their sticker. I ate it all.
As you've heard, today's Tri-Day vegetable is spinach. Mike says many of the kids may never have eaten it before.
Being in this area, they're not I'm not gonna say all of them, but the majority of them are not used to eating the vegetables.
How does he know? Mike says it's kind of obvious kids aren't used to eating something when they don't even recognize it.
Like I served chicken breast yesterday, and I heard a couple of kids say, well, what is it? It's chicken breast. So they're used to possibly just getting fried chicken or whole pieces of chicken. They're not used to getting a white meat chicken breast. So, just trying to educate them on different things. But, by the time they leave here, within the 2 years that I've been here, that I've seen, most of those kids, they recognize the food, they know what it is, and they're eating really good.
Do you feel like it's what you're teaching them here, trying to get them to try new things? Do you think that's carrying over into what's happening at home?
I hope so. Like when I served the spinach today, I'm hoping, a lot of people saying, nah, it's not going to happen. I'm hoping that most of them will go home and say, Mom, I tried spinach today, here's my sticker. So maybe when they go to the store, they may say, well, you know what, can we get spinach? I don't think that's going to happen, but, that's my goal, to get them to at least try it.
Pretty soon, it's lunchtime and time to put that spinach to the test.
Who knows what it is? What is it? Spinach?
Green. Collard green.
Oh, collard greens. That's what I was shooting.
I tried it.
It's spinach. So come and see me. Come through here when you finish eating so you get your sticker.
The kids eat fast, and Mike starts handing out those coveted sticker rewards.
You want to be the first one in line for your sticker, I see.
Hang on. What's your name?
Jaden
And what's your last name?
Williams.
Jaden's 9, headed into 3rd grade next year.
So what just happened there? What'd you just get?
My try day sticker.
And how come you got that?
Because I tried the greens, the spinach.
Had you had spinach before?
Yeah, but I like mine with hot sauce.
But what'd you think about it today? You tried it though.
Yeah, it tastes good. Just need a dab of hot sauce. It will taste better.
After getting Jaden's culinary recommendation, I conducted a very unscientific survey of some of the other students. Their reactions were mixed.
How was it?
Good.
Do you think you'd eat it again?
No. I thought it was collard greens at first, but I couldn't finish it because as soon as he taught me it was spinach, I said, spinach? I think it was great.
I don't like spinach. I'm allergic.
Are you making that up or are you really allergic?
I'm making it up. It looked weird.
It was from the garden.
What's bad about it being from the garden?
It was bugs on it.
You saw bugs on it?
No, yeah. Literally. It smelled like grass.
You didn't want a sticker? Didn't matter? Still weren't gonna try it?
Not even for $1 million.
How come? What's so bad about spinach?
What's bad about spinach? It stinks.
My very biased survey sample notwithstanding, it actually seems like most of the kids do try the spinach and get their stickers. After lunch is over, I head back into the kitchen one last time to get the official Tri-Day results from Mike.
So overall, successful, not successful?
I think it was successful. Yeah? Yep. I think we got a lot of them to eat the spinach. Some of them said they've eaten it at home before, and others thought it was collard greens, well, mustard greens. So they liked it, and so I'll be adding it to the menu.
Mike says the next thing up for Tri-Day will be Brussels sprouts.
I know my chicken. You got to know you're chicken. I know my chicken. You got to know you're chicken.
Let's get on to part 2 of our show, housing.
So we asked Principal Arandu to tell us about the connection she sees between where kids live and how kids do in the classroom. As she often does, Arandu gave us her answer in a story.
She's a single mother, and she has 3 kids altogether. One of them is here. And so I noticed that the child hadn't been to school. I always, 2 days, and I'm calling you. You gotta tell me where this child is. You gotta tell me why he hasn't come to school. And she says, well, the bus is not coming. I said, well, I'm coming to pick her up. And when I get there, today I would like to do a home visit. So she says, okay, come on in. And I said, okay, just get her ready for me, but I'm coming in. Don't bring her to the curb. I'm coming inside the house. When we got there, you could smell this mold coming in, but the house was spotless. She's a very clean lady. Everything else was clean, but there was water on the floor, the kitchen floor, and she opened up the cabinet door, and you can see that there's leakage that is going. It's just permanent leakage that's been there forever. You can see the molds under there. Her kids have asthma. Her kids, all 3 of them, they have asthma. Nobody has done anything to help her with that condition. A lot of our kids live like that. They come in with this asthmatic condition, and if they are not breathing well, they're not going to be able to attend in class and do the work that they need to do.
1 in 5 kids at the school have asthma.
And remember, she says a lot of kids are living in the type of conditions she described, living in rundown homes with lots of health hazards.
Like Tracy Haynes and her children, Trayshawn and Ternaya.
What's your favorite subject?
Playing and recess.
I agree. I agree with the playing at recess.
What about you? What's your favorite subject?
My favorite subject is math.
What grades are they in right now?
First and second.
Okay. And then so starting in the fall, they'll be in
Second
and third. Tracy is a single mom of 2. She had her first child at 16. She loves being a mom, but she says sometimes it's a struggle because she feels like she's growing up with her kids.
She currently works as a patient account representative for a hospital. She makes decent money, but it's not enough to make the repairs she desperately needs on her home. When we met Tracy and her kids on the first day of school, they lived just a few blocks away.
From the outside, their house is stunning. Classic red brick, arched doorways, strong and imposing in its size. On the inside, it's a completely different story.
When I first got here, we repainted. It was a lot of, this chimney is not done right, or something's not right with it, where it was a lot of smoke. Like the walls were all black, and we tried to paint over it, but ended up happening again, even though we didn't use the fireplace this winter. That's how we used to heat this room, the fireplace. There's fireplaces in every room, but I guess the smoke's not healthy either. That's another reason I'm glad we're leaving.
And that was just the beginning of the problems. Standing in the dining room, she directs my gaze to a hole in the ceiling.
This is the upstairs bathroom in the master bedroom that's leaking. So when the water runs in the tub, it leaks down. And this just recently started. We used to never have a problem with that. In that corner, yes, but it never used to leak that bad right there. So whenever my mom's husband came over to try to fix it, it seems like it started leaking worse.
Across the way is a downstairs laundry room and bathroom that flooded when the pipes burst this winter.
There's a lot of mold where it used to leak behind the sink. I would never let my kids use the bathroom in here.
The kitchen is useless because the water doesn't work.
Upstairs, they lost power on the entire second floor for a while when a fuse blew. There are more leaky bathrooms and a roof that needs major repairs. And on the ceiling above Tracy's bed, a common problem in many homes that have fallen into serious disrepair, more mold.
That looks like mold from it leaking. Like eventually that's going to fall. And thinking of us sleeping there and eventually like looking at the cracks, it could fall in any time. I was like, we can't really sleep here.
She was staying in the house because, it's cheap. The house is family owned, given to her by her brother.
When she moved in, she was like, great, I don't have to worry about paying rent.
That's a good deal.
Yeah, I don't have to, my family can have a safe place to stay. I don't have to worry about finding a place to stay. And she figured that she would save up money that she wasn't spending on rent and fix up the place. But on her sole salary alone, she can't really afford the $100,000 worth of repairs that are needed.
So they're moving out because the house is physically, mentally, and financially, of course, draining.
Their new apartment is just a mile down the road. The new space is much smaller. The kitchen is not quite finished, and they haven't even finished painting yet.
Push the refrigerator back so I can use it. Finish in here so I can use the stove, and then we have a basement where I can go down there and wash, but I have the stuff right there, and I haven't been able to even get down there to see.
So you're moving when the house isn't quite ready yet.
Right. But it's like I really don't have a choice. This is better than where we're at.
Trying to leave her old house and waiting for her new place to be finished has left Tracy feeling exhausted.
Going through the struggle of these past 3 weeks, just basically being homeless. It's been hard. It's overwhelming here, but at least we have a place to stay.
You made it into a house. You made it into a house.
I just know I'm getting closer, and I just can't wait till it's over. It's been really hard.
As you can hear in her voice, the whole experience has been trying, but Tracy says it's worth it. Because in this house, her children can be healthy.
My kids will be able to breathe better, be able to eat dinner together, do more family things, be able to raise them better in a better environment where they can get up, make up their beds every day, brush their teeth, come home, take baths, know where their clothes are, know where their shoes go, not have to worry about getting splinters in their feet or hurting themselves. It just means a lot to me to be able to raise my family in a better space, even though I'm going to be paying rent versus not paying rent here. I'm paying for health.
So we're going to stay with Tracy and her family as we move to part 3, mental health. And just like the other issues we've addressed, there is a strong connection between mental health and poverty.
Specifically, there's a connection between bad things happening to you when you're a kid, what the Centers for Disease Control and Prevention call adverse childhood experiences, and mental health problems like depression, drug abuse, and even thoughts of suicide.
For many African Americans in St. Louis, mental health needs are not being met. Just as an example, the rate of hospital stays for issues related to mental health are 64% higher for African Americans in St. Louis than whites, according to the For Sake of All study. Emergency room visits related to mental health are 121% higher for African Americans in the area.
Tracy wants help for her and her children. She says her kids have been through a lot.
Just witnessing domestic violence, witnessing things that they shouldn't have. Having a mom that's been a teenage mom at a young age, not really having guidance to know which way to go, growing with them. That's trauma enough that I'm growing with them.
She's trying to get counseling for herself and her kids. She says she's especially worried about her son, Trayshawn.
He struggles in school, although he's doing much better this summer session. But Tracy wants to find him help to deal with his anxiety and depression.
Well, that's what he needs. He needs somebody to be able to talk to, because my son doesn't talk to me like I think he should, like me and my daughter would. He doesn't. I feel like maybe he's feeling some type of way about his dad being incarcerated, but he doesn't know how to express it. Just the stress of having to grow up with a single mom is enough for a kid to be I understand why he's depressed. That's totally understandable. Just everything he had to go through with me or see me go through. Now I understand, but it's too late because my kids are already, I'm not going to say damaged, but internally
They've experienced.
Right. It's nothing. You can't take that back. I could try to fix it, which is what I'm going to do. Try to fix it so when they're older, they don't turn into some of the stories that I've heard because the parents didn't get the help that they should have later. That's my goal, just to make sure they are okay eventually. It's going to take some time because it didn't happen overnight. But my ultimate goal is to make sure they turn into successful adults.
She has her own goals, like maybe going back to school, finding a better job, but she says it can be hard, especially in St. Louis.
My kids are great. They really keep me going. They give me hope. I think I probably would have committed suicide a long time ago if it wasn't for them. That's the reason I'm here. Other than that, it's so hopeless being here in St. Louis. It's really hopeless.
Why do you feel so hopeless in St. Louis?
Just because the stuff that happens here is so unbelievable. Just like, I can't believe, because I sit back and I'm like, I can't believe that just happened.
What Tracy cannot believe is the deadly violence in St. Louis.
There were 92 homicides through June of this year in the city, up 60% compared to last year. 1 in 4 of those homicides happened in 7 neighborhoods surrounding Northside Community School.
Yeah, that's where many of the students, including Tracy and her family, live.
Right.
Principal Arandu tells us the effects can be heartbreaking.
We identified a lot of our students that are have first-hand experience with trauma, especially the killings that are going on. One was a student who went home on Friday with dad, and they were going somewhere, and they're getting out of the car, and someone just shot dad. And dad holding his hand while they were getting out of the car and trying to walk to the apartment. And so he saw his dad fall, and he saw the gunman. He came to school on Monday and came directly into the office and just fell into my arms and just cried. And we couldn't believe it. We just I didn't have words to the way I felt. And I didn't know what to do for him. So we called his mom. His mom lived somewhere else, and we called his mom, and we then started the process of getting him some help.
Arandu says they found some money to bring in a full-time social worker this fall, and the need to coordinate social services for children is pressing.
Yeah, for example, Washington University's For the Sake of All reports on St. Louis's health disparities notes that poor mental health in early childhood is associated with a string of problems like dropping out of school and higher rates of incarceration. Our fourth and last part of the show is about access.
Yeah, and a lot of the time that means just getting to the doctor.
Exactly. So there is a health van that comes to the school a few times a year, and kids can get diagnosed and treated for basic things like asthma and poor eyesight.
But the next step is, getting kids to follow up at a visit with a pediatrician or a specialist.
And Arandu says for many parents at the school, just getting a kid to a follow-up visit can snowball into other problems.
Many challenges to the follow-up issues, like, for example, referring a child to a doctor. And we told you this in January and it's March, and you still haven't made any connection with any pediatrician. I don't know who to call, but I gave you a pediatrician, I gave you a clinic, so a lot of it is transportation for the parent to make that appointment and get the child there. And I was saying that the other thing is the type of jobs that our parents have is a healthcare issue. Single parents are trying to juggle everything and to see themselves in danger of losing a job because they took off to take care of the needs of their children 3 or 4 times a month, which is possible. I do it, when I was my kids were little. But these parents don't have those luxuries. The other mental health issue is the parents' level of frustration and anger, because then they yell, "I'm doing this and that," and they yell at the kids and say how hard they're working, and they are. And why should I take off? If I take off from my job today, I'll be fired.
What Arandu is talking about is something researchers call toxic stress. And children living in poverty can be especially susceptible to it for all the reasons Arandu just laid out.
Yeah, it sounds a lot like what we heard from Tracy. She's under so much stress from trying to find housing, work. She's worried about her children's school, health issues. There's just a lot going on.
No kidding.
According to a Harvard study, living with toxic stress can actually weaken the architecture of a developing brain, which in turn can lead to lifelong problems with learning, behavior, and physical health.
All right, so now what? When it comes to kids living in poverty and health in St. Louis, where do we go from here? Well, for Arandu, she says the change for her actually started from within. She tells us one last story. This time, it's about how she used to look at parents who had kids with chronic health issues.
You are the parent. You have had this child at least 4 years prior to I'm getting this child. Why wouldn't you notice some of these things and go try to get him or her some help? And if there is public health help, you should seek it out. They won't bring it to you. You should get out of your house and go find a way to get that help. But when the child reports to school with those issues, then I can't educate him or her. And I used to think in my head, well, this parent should do something. But it's no longer a parent's job when they get to the school. That's what I had to convince myself. It is my job now. I have to do this for this little child because he or she can't do it for himself or herself. I have to do that. So I will get the parent on board. We'll go and get the public health help that the child needs. Public health help. That's a mouthful. Anyway, when I started thinking this way, because I'm telling you now, this was not my original thinking, I found out that my parents were not only grateful, but ready to go with me. They were able to go with me. I saw that the handicap was not that they didn't want to do this or that they were lazy. It was just that they didn't have the knowledge. They didn't have the know-how to go out and get the help that their children sorely need. What I also learned from this is that the next child in that family got help. Because now a parent has a track record, knows where to go, knows how to do it. She will ask, she will verbalize, she will know what agency to go to. Okay, so it opened a lot of doors for me.
The approach she's describing dovetails with a model laid out by the Centers for Disease Control and Prevention that looks at schools like hubs for coordinating health and social services for kids.
For example, one part of the CDC model calls for putting health centers inside of schools, which has actually happened in a couple high-poverty high schools in the city.
But again, there are only a few examples of health centers being in schools. So what do people do?
Well, I mean, assuming they know about their options in the first place, most people go to a health center.
Right, so that's where we should go next.
Good idea. So next time on We Live Here, pulling apart the healthcare system by looking at what makes a federally qualified health center tick.
We Live Here is produced by me, Tim Lloyd.
And me, Emmanuel Berry. Shula Newman is our editor, sending well wishes to our sick puppy, Dobby, this week.
And Margie Freivogel is the editor of St. Louis Public Radio. Our theme music was produced by Cassie Morgan. And from St. Louis Public Radio, this is We Live Here.
At this time, all students and staff are dismissed.
Support for this podcast comes from the Corporation for Public Broadcasting.